Introducing the Paramena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Paramena Bliss Podcast.
Hey, this is Doc Yates, and welcome to the Paramena Bliss Podcast, and brought to you by ablehealth.us and perimenobliss.com. Today, I want to talk about gluten. This is something that I talk about, and people ask me questions about every day at clinic. They always want to know about gluten. Could this be gluten? Is it gluten? I don't think it's gluten. Let's go through it. Because typically speaking, when you go to your doctor and you ask, I think I have a gluten intolerance, or I'm allergic to gluten, so they'll do what is called celiac testing. And the gold standard for celiac testing means that they're actually going to do a biopsy. They usually don't do this unless you have severe digestive issues. They do a biopsy of your intestinal tract. They're looking for the worn out of the villi. And then there's different antibodies that they can check specifically for gluten. Most of the times, you're not celiac. The vast majority of people are not celiac. But the thing is that just because you're not celiac doesn't mean that you're not sensitive to gluten. I have had so many patients that have all of these bad symptoms, digestive symptoms, fatigue, achy, headaches. They go for check for the celiac. Lo and behold, they don't have celiac. Not a big surprise. So the doctor's like, well, it's clearly not gluten. And then I have them avoid gluten for a couple weeks. They feel better. I say, perfect, now eat gluten again. Then they feel worse. That, to me, is the gold standard test, the eliminate and reintroduce. Now, I want to go a lot more into detail into the how to eliminate and reintroduce a few points later, but just because you've had celiac testing does not mean that you do not have a sensitivity to gluten. Okay, let's go through a few points related to this. Point number one, just because your symptoms are not related to digestion doesn't mean that it's not a gluten issue. People are like, well, no, I'm talking about headaches, or I'm talking about neck pain, or I'm talking about joint pain or skin issues. I don't have any digestive issues. Doesn't mean it's not related to gluten. When you are getting an immune reaction to gluten, it can affect any system. In fact, I remember looking at a study that showed that a case where people had inflammation affecting their brain and sclerosing affecting their brain that showed gluten antibodies in it, but yet they had no digestive issues, no other issues whatsoever. So, it can play a role with any one of your systems. So don't think just because you have regular daily bowel movements, no digestive issues, that therefore your symptoms are not related to gluten. Point number two, I would go as far as saying that any inflammatory or autoimmune condition, you should at least, as a minimum, be ruling out gluten, which means you should be cutting it out as a trial just to see, because it's indicated in autoimmune thyroid issues, autoimmune joint issues, autoimmune skin issues. Always, always, always at least pull gluten out for a period of time as a trial. That I would consider a must. Number three, people are like, no, I don't think it's gluten because I've been eating gluten all my life and I've been fine, and now these symptoms just started, within the past couple years. Gluten intolerance, gluten sensitivity can develop later in life. So just because it was an issue before doesn't mean that you can't have it now. And now in terms of why can these issues start, or why do they develop? I have seen them develop after periods of really high stress. I've seen them develop after periods of anything else that could have irritated the digestive tract. Sometimes like a bad viral bug, or people get parasites, or people get food poisoning. Anything enough that really irritates the digestive tract can lead to the onset of food sensitivities. Not just gluten, but food sensitivities. So those are things that can happen. And a lot of heavy antibiotic use, I've seen that trigger sensitivities develop. Again, anything that can mess up your guts can lead to a gluten sensitivity. Or sometimes it's not even digestive related, as I mentioned earlier. Sometimes just a really divorce, high stress, loss of a family member, a loved one, something along those lines, that can lead to sensitivities. I've definitely seen that many times in practice. The next thing, when it comes to gluten, is a lot of times it's not gluten. A lot of times it's specifically wheat. So there's a lot of people I've seen that I think a lot of times people use it kind of interchangeably, but it's not the same. Gluten is a protein in wheat, but gluten is also a protein found in rye and in barley and a little bit in spelt. There's a lot of times I've found people, they're wondering about gluten, but yet when we reintroduce some of these other gluten-containing grains, there are no issues whatsoever. But once they put wheat back in, specifically wheat, that's when the flare-ups start. Now, I would agree that wheat has typically a lot, especially North American, that dwarf wheat has a lot more gluten in it compared to those other products. But there's a lot of times you can simplify the amount of things that someone needs to avoid by not having to cut out all gluten-containing grains, but wheat. But when we get to here we go. I can never speak. I always lose my voice and words sometimes. But when you're doing the initial elimination, you actually do want to eliminate all gluten-containing grains. And then when you're reintroducing, you start by introducing gluten-containing grains, but not wheat first. So we'll get to that in a moment. The other thing is that the next point is that point number 5, there's often other sensitivities besides wheat. I saw a client earlier this week, and they were kind of questioning whether gluten had played a role, and they were telling me about all their digestive issues. And so this was a clear digestive case. So I had asked, well, have you tried eliminating gluten before? And they're like, yes, I have eliminated gluten before, and I eliminated it for a year. And I'm like, wow, that's a really long time. So what did you notice? They're like, well, I still had the symptoms. And I was like, oh, well, they're thinking, well, so therefore clearly it wasn't gluten. But then I dove a little deeper. I'm like, did you have the symptoms just as bad? She's like, oh, no. They were at least 60%, 70% better. And I was like, what else did you eliminate? She's like, just gluten. So right off the bat, because it didn't get 100% better, she was thinking, therefore gluten was not related, when it clearly was related. But the next point is that it's not always just gluten. There's a handful of common food sensitivities, and what you want to do is eliminate those most common problematic ones. Then you wait till the symptoms clear. You do as much as you can to make the symptoms clear as fast as possible using natural treatments. And then you put those foods back in one at a time, generally starting with the ones that are least likely to be problematic. So in that case of that patient, she had pulled out gluten. She got 60% better, which for pulling out just one thing is actually really impressive. It's just too bad that the nutritionist she was working with had her just do the same thing for 1 year, even though there wasn't more progress being made. That should have been adjusted. They should have been pulling out more things or trying different reintroductions. So the point is that it's not just gluten, it's not just wheat. Usually when some of those sensitivities develop, dairy is another common one, sugar is another common one. And some of these things are sometimes, once the digestive system kind of gets a little bit weak and irritated, then you can't even digest. So you take some of the harder to digest foods, like a lot of raw veggies, you have them switch to cooked veggies for a period of time. You want to make it so that it's ridiculously easy to digest and absorb all these nutrients and to break everything down, put no strain on the digestive tract while it's healing. And in doing that, typically adding some bitters, some specific bitters that I like to use. Bitters are herbs that stimulate your digestion, make your digestion stronger, and kill off problematic bacteria. You do that, then you start with the reintroduction after the symptoms are cleared. That's typically the way it works. Another interesting thing about gluten and wheat is that it seems to be specifically worse. I keep saying specifically. It seems to be much worse in North America. I have had a lot of clients who are very sensitive to wheat. They go on a holiday to Europe, say France or Italy, and then they eat wheat there and they have no symptoms whatsoever. So I've heard a lot of theories about this, that the way we use a different type of wheat, the way we process our wheat is different. There's a lot of different ideas. There's something specific about North American wheat that we use that is much worse than other wheat is. Which would also make sense why when you see like older clients, when they're like, no, I had wheat when I was fine. It was never an issue when I was young. And then eventually over time, they started developing sensitivities because maybe they hadn't changed. Maybe the wheat had changed, and then they eventually developed sensitivities to that. And again, just to reiterate, there's a lot of times people are thinking, well, I've already tried avoiding gluten and it didn't work. There's a good chance if you have a lot of these inflammatory issues that gluten is probably still related. And I hate to say it, but if you came in, I'd probably make you pull it back out again, but I'd make you pull out a lot of the other more common problematic foods at the exact same time, because it's rarely just the one thing, unfortunately. So just to review, we take the most common problematic foods, we pull them out. We take the foods that you are eating, we cook them and make them into a state where they're very easy to digest. You add bitters. There's some other things you can add, like I like to use slippery elm powders with licorice extracts and glutamine to heal the intestinal tract. You get the intestinal tract all healed, and then you start with a reintroduction after. So you want if you had symptoms, say like 8 out of 10, you want those symptoms to be 0 or 1 or 2 out of 10, like very, very minimal. After that point, your symptoms become kind of the measuring board. So you put the food back in, you eat that one food, you eat it for 5 days, a couple times a day for 5 days, and you pay attention. If you get any symptoms coming back, chances are that's a food that your body's just not doing well with still right now. You leave that food out for a longer period of time, then you introduce the next food after your symptoms clear again. So I hope this information, I hope you learned a few little tidbits about gluten based on my experience. So this is Dr. Yates. Doc Yates signing off.
Thank you for tuning in to the Paramena Bliss podcast. Don't forget to hit the subscribe button and visit paramenobliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Paramena Bliss podcast.